This class is especially for you if you have lower back pain, if you have had multiple injections, painkillers, and visits to a physio and chiropractor, but the pain keeps coming back. It is also for you if you have been told that you have a weak, deep core. For those of you who don't know me, I'm Dr. Kim. I help people heal chronic pain with somatic movement, breath work, and meditation. I specialize in working with people who have very complex and chronic pain, in particular lower back pain that does not respond well to standard treatments. I have been in practice for over 10 years as a holistic chiropractor, and I'm so happy to say that I have been able to help thousands of people heal their pain and reclaim their lives. So what is the deep core? When we talk about the deep core, we're not talking about the six-pack abs that lie on the surface. Your deep core actually lies much, much deeper. It is actually a pressure and support system that wraps around your spine, helping to stabilize it. So you can think of it as a cylinder. So for example, if your spine lay inside this bottle. So at the top of the cylinder lies your diaphragm, which is your main breathing muscle. At the bottom of the cylinder is your pelvic floor. Around the sides and the front is the transverse abdominis muscle. And right at the back is the multifidus muscle. When all of these parts work together, they create a gentle internal pressure that supports your lower back. What happens when people develop chronic lower back pain? This entire system stops working as a whole. The diaphragm, it often becomes restricted and it sits higher up in your rib cage and only moves up here. Breathing shifts to the chest and the neck, which reduces internal support for the spine. The pelvic floor at the bottom, it responds by either gripping too tightly or in some clients, it stops activating at all, so it becomes completely lax. Either way, it stops coordinating with the breath on top. Now, the transverse abdominis, which lies at the front and sides, and the multifidus muscle, which lies at the back. These muscles stop activating at the right time, and then over time, they start to become very weak. Basically, it's as if the entire cylinder goes all loose and floppy and does not support the inner spine anymore. What happens here is that your lower back loses the support system and it ends up highly stressed because it needs to take on much more load than it should. Over time, this increases the strain on spinal structures like discs and joints and can contribute to pain, irritation, and reduced movement. This is why so many of my clients don't have any lasting results from doing things like physical therapy. You can rub a sore muscle and adjust a joint every single day, but it is very rare that any practitioner will actually take the time to teach you the techniques needed to keep your back actually healthy for the rest of your life. I believe in empowering my clients with the knowledge they need to heal themselves so that you don't actually need me for the rest of your life. Today's practice will focus on teaching you how to gently activate your deep core using breath and awareness. It will all be done laying down. So I highly recommend using your bed. Lay down on your back, bend your knees, feet hip-width apart or slightly wider. Allow your knees to come inwards so that they're touching each other. This is important because it helps to relax the psoas muscle, which runs through the front of your hips. Place your hands on your lower belly just below your belly button. We're going to begin with deep breathing. The diaphragm is a large sheet of muscle that runs from your lower rib cage all the way back to your spine. Breathe in through your nose, feeling the air travel down your throat and into your chest cavity. As you inhale, feel your diaphragm moving downwards into your belly. As you inhale, feel the pressure created in through the lower belly and the spine. This is very subtle. With each inhale, feel your diaphragm move downwards. With each exhale, feel it relax upwards. Inhale, diaphragm moves down. Exhale, diaphragm moves up. Feel the subtle pressure it creates. Now we've activated the top part of the cylinder that comprises the deep core. Place your hands on your waist, thumbs wrapping towards the back of your spine and fingertips laying on the surface of your belly. Inhale. As you exhale, pull your belly button down in towards your spine, like you're sucking your belly in, creating a vacuum. Inhale and relax. On your exhale, do the same. Exhale and pull your belly button in towards your spine, creating a vacuum. Inhale, relax. Continue this pattern, pulling your belly button into your spine with every exhale. Keep your breaths slow and long. You should feel your deep core muscle, the transverse abdominis, tighten underneath your fingertips with every exhale. Your thumbs should also feel the sides of your waist contracting and moving inwards. This is your deep core that you're activating. You can physically feel the pressure it creates around your spine, that stability with every exhale. A few more breaths here. Enjoy the feeling of tightening your deep core. breaths nice and slow, nice and smooth. Last one. And completely relax. Move your hands to your sides, palms up to the ceiling. Straighten your legs down. Inhale, feeling your diaphragm move down. On your exhale, pull your lower spine down into the bed, feeling your deep core contract as you do so. Squeeze your glutes together. Breathe normally. And feel the strong brace we've created around your lower back. Feel the strength and stability you are giving your spine using your glutes and your deep core. Squeeze firmly. Breathe normally. And now relax. Relax your eyes, your neck, your legs. And again, deep inhale. Exhale and press your spine into the bed. Squeeze your glutes together. Hold and breathe. Here we're not only activating the deep core, we're also decompressing the lower spine, creating space between the bones, allowing your nerves to exit and your multifidus muscles to stretch out. Any shaking here is completely normal. It just means your deep core hasn't been activated properly in a while. And now completely relax. Consciously relax your entire body. And last one, deep inhale. Exhale, pull your spine into the bed and squeeze your glutes. Deep breaths. Create a brace around your lower spine. Create stability in your own body. Five, 4, 3, 2, 1. And completely relax. Let's finish with 3 deep exhales through the mouth. Inhale through the nose. And exhale all the tension out of your body through your mouth. Inhale. Exhale through the mouth, allowing all of the stress to leave your body. And last one, deep inhale. And expel all of the stale air in your lungs. Body completely relaxed. stay here for as long as you need. If you've had lower back pain for months or years, this is only a very small part of the first step in healing it. I guide people through restoring the deep core, the psoas muscle, the glutes, and the nervous system in a very specific sequence that is designed for chronic lower back cases. If you want access to all of this and you want to go deeper into this work of holistically healing yourself, you can click the link in my bio. Thank you so much for practicing with me.